All right, so this is our suture kit. We've brought it into the room. You don't have to worry about opening it up and setting it out or putting it under the bin, under the foot of the bed. It's actually important. This is autoclaved, so it's clean. It's been sterilized, and as we open this up, we don't want it sitting in the room for an extended period, so we like to cover it and keep it protected. When I open this up, I'm also very mindful of what I touch. I don't want to touch the parts of the instrument I'm about to use, and I also don't want to set them here because this has not been autoclaved and this is not sterile. So when it comes to sterility, some of the key concepts are to basically be mindful of these things. So I just touched this, and now if I shut it, now it's going to contaminate it. So just imagine there's germs on everywhere except for inside of here, so we got to protect that. So I'm going to pick up these two instruments, and again, even as I'm touching them, the working part, the tips of them, I'm going to be very protective of them. So when I'm not using it, I touch this part, so I'm going to put it back here. That can rest here because again, that's the part that needs to be clean, right? So we're just going to rest that a second. I'm going to show you next the suture. This is nylon. You see that it says nylon there in green, and this is what the needle looks like, and you see that it says 2-0, and that's the gauge or the size of it. 3.0 metric, but we go by this 2.0. Sometimes it'll say 3.0, 4.0, and then that's the diameter, how big it is. 2.0 is bigger than 3.0, and then 4.0, then 5.0 is actually smaller, so it's kind of backwards or not intuitive on the size. As the number goes up, it gets smaller instead of bigger. And then it matters what the size and gauge is, and also the material. Sometimes this is Vicryl or some other material. So nylon is black, the label is green. As you do this more and more, that will become second nature. So we look at this, and there's a little area where this is loose on the end, and I'm gonna just peel that open. Okay. So again, this is clean or medically clean or sterile on the inside of it. So as I open this up, we're gonna put this in somebody's body, right? So as I open this up, I'm not just gonna grab this without thinking about what we're doing next. So I'm gonna pinch this with my fingers up here. That's trash. This has a little label, it says open. There's a little perforation, it says open. So I'm gonna peel that back. Got that little notch there, so I'm gonna peel that back, and then we're looking at the needle. Okay, so I'm doing the suturing, so I'm the one that's gonna be ready for it. If I'm not ready for it, we don't open this until we're ready for it. If you do that to assist, that's fine. I need to grab it like this. So to present it to me, you're gonna present it to me so I'm looking at the hook. Not this way, because I can't grab it easily. Not backward, I gotta be looking at the hook so I can come in straight and grab it. I don't know how to say that better than that, but to show you, present it to me this way so I'm seeing the hook so I come in and grab it. Again, we're not touching the black nylon coming out of there. We're not touching the rest of this. Come over here with me now. We've already prepped the area that we're gonna put a suture. Okay. And more broadly than just that area, in case the nylon touches the rest of the skin there. We know it's gonna bleed, so we're ready to throw our stitch, and then having a gauze to maintain our mess, so to speak, where it's gonna be bleeding. We don't want a bloody episode from Forensic Files in here. We wanna have the basin under the patient. I'm gonna not touch the needle, I'm gonna touch the thread as minimally as possible. Okay, if you grab the scissor there, we'll just demonstrate that too. So in this case, he had surgery and a couple of the stitches didn't do their job like I wanted them to, so we're throwing another stitch across this, trying to bring the soft tissues together. Okay. do need to touch things, and I'm going to tie this and then we'll be done with this example. Okay, we don't need to cut right at the knot, about an inch or a couple centimeters or so up. Perfect. So that tail's done. Reposition this, throw it again. That's the cleanest way that we can do this, minimally touching everything. Now, sometimes this isn't adequate enough. In those examples, we have to go to the OR because there we have sterile gloves and sterile preparation, and we can be more sanitary and sterile. But for a lot of office procedures, this is adequate. This patient has neuropathy, so he doesn't feel this. He did not require anesthesia or a block. He's not yelling at me, at least yet. And a lot of people in these situations have neuropathy, and that's part of the reason that they have a problem in the first place. But if we need to anesthetize somebody, we can do that in the office as well. Great, thank you.
Mm-hmm.
Thanks for being part of science.
All right.